You guys, oh, I like that. Can you guys hear me? Perfect. So I've met some of you guys actually before at our previous education event, but I was invited tonight by Dr. Weaver to give you guys a little bit of education, particularly on a subject that I routinely get called out to see, and in our hospital at the College of Veterinary Medicine, we see quite a bit too. Looking at lactation management, particularly two diseases that really harp on the sheep industry that we see quite commonly, either misdiagnosed or completely just switched up in their pathogenesis. So I wanted to focus a little bit more on the veterinary and health side of recognizing these, knowing that I think I'm obviously a little bit biased. I am not a nutritionist, that I leave that expertise to my right. But I'm more than happy to answer any and all questions that you guys have here. If you have a question, you guys can definitely say that in the chat and we'll read those at the end. But since these guys got to be in person tonight, feel free to stop me and we'll discuss, and I'll repeat the question for anyone not here. But I'm Dr. Danielle Mzyk, and yes, there are no vowels except sometimes Y in my last name. I married into it. And I'm actually a field service veterinarian with NC State's College of Veterinary Medicine. I focus particularly in my research and in my extension and my clinical teaching on small ruminants. I actually went into private practice up in Erie, Pennsylvania, followed my husband while he decided to spend more money and get another degree and go over to Madison, Wisconsin. I did mixed animal practice there and then got recruited back to teach in our field service and teach students how to be successful ambulatory mixed rural vets. And what mixed rural vets means to me is teaching them to recognize diseases in all sorts of animals, not just dogs, not just cats, not just horses. I'm obviously very passionate about Dorsets, which I think I might be alone in the room. I don't know, but this is Prince Louis. He doesn't have one of his legs, but I couldn't euthanize him. So I pay for his farm call every year in Wisconsin. One of my old techs has him, and he's now 250 pounds. He's doing great. But you're probably wondering what in the world is those letters after that name. I'm actually a clinical pharmacologist. So I do a lot of treatment of diseases and looking at studies on how these works. And my research area is actually how do drugs work in small ruminants. So I figured this is a perfect topic because although I am a pharmacologist, I do not believe drugs are the answer for everything. And so we really need to focus on learning what these disease processes look like. Then we'll get to eventually the meh part about treating that. But I really am a big fan of recognizing and preventing disease rather than treating, because by the time you call me to get treatment, these guys are real sick with small ruminants. But I think it's really important to know that my background, I'm actually a city kid. I grew up, I would say in Governor's Club, but but near Governor's Club, actually in Orange County, right off of Old Lishford Road. And so I'm a Orange County native by trade, but I'm an NC State fan through and through. I actually did most of my practice in mixed animal practice, in private practice. Although you guys can tell that is a Katahdin, I'm still a Dorset fan, far and away. I do mission trips out to the Navajo where we do 3,500 to 4,000 sheep every summer. And I do a lot of teaching students how to work with sheep. Not a lot of lactating sheep, particularly in our practice area, but working to build on that research area as well. So for me, one of the big things that I wanted to point out as we go through this presentation is you guys already know this, but if we can increase the productivity of our ewes, that generally it will increase the amount of milk they have, which also translate, particularly in our lambs, to more meat and more marketable sale weights. That milk yield has been proven in multiple studies to actually have the strongest predictor of the lamb's average daily gain, their increased weaning weight, and the total number of pounds of weaned lamb per ewe. So this is a big deal. If you're ignoring the actual ewes just to try and increase the average daily gain of all your lambs, the ewes are the reason that's happening. Initially, getting that milk actually to build up that rumen, get them actually growing well. If you can't do that without a good ewe, without good milk coming from them. So milk definitely does equal meat. It just takes a little while to get there. For our presentation today, what we're going to focus on are two big diseases that I see in clinical practice that kind of get mixed up a little bit when it comes to diagnosis. And then how do we diagnose them? What are our common causes? How do we, particularly, I don't spend too much time on treating them because one of these is not the easiest to treat. Excuse me. And then we'll kind of you guys as producers, what you can do to recognize, how you can diagnose, and then particularly how do we manage those on farm? Because these are pretty costly diseases to our small ruminant industry, and particularly in our sheep. We're going to focus first on what is mastitis, because that is the most common thing that I will see when I'm get a phone call from a producer asking, my lambs look skinny, and I get out there and I look at this goat, or sorry, this lamb or this lamb, it's hungry, it's trying to nurse, and then I'm like, where's the mom? You flip the mom over and her udder is trash, right? It is hot, it is red, it is irritated. That inflammation is why mastitis, that itis is at the end of the word. That means inflammation of the mammary gland. So that can be anywhere within the system and the anatomy of that mammary gland. Typically, this is caused by some sort of bacterial infection. That can be presented when we have mastitis as a clinical diagnosis. We can have subclinical, we can have acute, and we can have chronic mastitis. Those are ways that, honestly, vets make it more complicated, but it kind of gives us a prognosis and also as a treatment decision tree, how we make that discussion to go from should we treat this or should we not treat this or should we cull this animal, trying to figure out which animals should we keep and which ones should we treat really makes this a little bit difficult because mastitis is not uncommon in our small ruminants, but it can be pretty devastating. We think about this in the dairy industry, particularly in cattle, because this is one of the most common things that we treat as, food animal vets. But in sheep and goats with the udder that small and not as much milk production, it doesn't always cross our mind until we stop seeing lambs that are growing well or they're not feeding, or I will tell you, the small ruminants get really, really sick. When a cow gets mastitis, depending on which bacteria it is, they get a little off feed, they drop in milk, but we're not always milking out the sheep by hand all the time. And so by the time I get presented with these guys, they are systemically very, very sick. Some of them udders are falling off. Some of them got sepsis. It's pretty bad by the time I get called. And so my goal is for you guys to get some of these common symptoms, check what I would find my producers, I want them to look for before they actually lose that animal. So the first line of defense in the mammary gland, when we talk about mastitis, is that you've got the anatomy. This is the sphincter. And the first one I put up here was a cow. And I was like, they're going to call me out on that one. So here's their teat sphincter, and this is the cistern. So they've got this teat cistern right here, right? And so when the lambs are nursing, they can actually open up this teat canal, and it generally will close around 2 hours after they've been nursed. We all know that lambs generally don't just nurse once or twice a day, that we want them actually nursing multiple times a day. So that can lead to very opening of this teat canal. And if it's damaged, if it's dangling near the ground, if the lambs are continuously headbutting it, if we've got any sort of environmental contamination, you can see pretty quickly how a lot of damage to these teat ends can open this up to a pathway for that bacteria to go from the street canal, which is this part right here, up into that gland cistern. All the milk doesn't just hang out here. When you have an activation of that milking reflex, all of these alveoli and all these little sacs will release that milk from the cells that actually create it and fill this cistern. But now if I've got bacteria that's coming usually from, I will say, the environment or even on the skin or from the lambs themselves, that travels up here. Milk, if you've ever left it in the fridge longer than 2 weeks and never opened it again, you guys know what I'm talking about, right? It will grow, and it's a perfect medium. It has fat, it has energy source. It's perfect for growing bacteria. So is the udder. The only difference is our udder is nice and warm and probably grows it exponentially faster. And so when we got all this bacteria in our milk, that can actually set up shop as mastitis within the cistern, which is this part of the udder right now, or depending on the bacteria, can actually get lodged up into what we call the parenchyma, or the outside of that tissue, because looks relatively large on this picture. If you actually if I necropsied another udder right now and open it up for you, it's actually quite small, unless they're in the heat of the peak of lactation. And so that bacteria can then affect the milk here that's sitting, or go all the way up into the parenchyma relatively quickly and cause a lot of damage and cause a lot of inflammation within the whole udder itself. You'll notice that we've got this septa right there in the middle. And that's why a lot of the times when you've got one half of that udder affected, it doesn't always cross over into the other side. And so we've done surgeries where we'll remove half the udder of a goat to protect the animal from sepsis, because that's the source of infection. If I can get rid of that, I can generally save the animal depending on how bad it is. But if this barrier is broken down by either damage or bacteria, that can then cross over. But generally, when you're seeing mastitis, it's usually one-sided. And we're looking at differences. I always tell my students, look for symmetry. If this side looks different than this side, it's probably weird and probably need to investigate it. So particularly with mastitis, that's what we're aiming, that's our first line of defense, is making sure that we can close this sphincter so bacteria cannot enter into the udder and go from there. The second line of defense is what you guys have probably heard of as somatic cells or our white blood cells. When these go up, their goal is to invade and destroy any pathogens that are within the milk or within the teat itself. And so this is a pretty common response to any sort of pathogen or even disease process that's happening. And so the problem with this one is when you get bacteria at high enough levels, it can overwhelm your immune response within the udder itself because all these immune cells live within the parenchyma. When you test milk, the somatic cell count will go up if they have a bacterial infection. That's one of our screening tests, particularly for dairy cattle. Goats and sheep generally have a higher somatic cell count regardless, purely from a volume dilution. So if you think about a cow milking about 100 pounds a day, if I had a sheep milking 100 pounds a day, I'd call you a liar. That would be pretty nuts. But that's because they're diluting out their somatic cell counts versus these guys, which can run up to, I think, over 1 million, depending on what animal we've got. Now, the presence of white blood cells does not equal a bacterial infection. But when I'm using that as a screening tool, you guys have probably heard of the California mastitis test. That is one way that you can test for, and as a proxy, the somatic cell count. Those are just the white blood cells. If you use a CMT in a normal animal, depending on what their average somatic cell count is, even in a healthy one, they'll sometimes pop positive and not actually be mastitic. So that makes it's obviously made for dairy cattle with a little bit more specificity. I use it as an initial screening tool, but if they are automatically already higher than normal cows, we kind of use it and take it with a grain of salt and use other clinical signs when I'm taking that test. So now we're going to differentiate between things like acute mastitis, chronic mastitis, and subclinical mastitis, because I think that is a very good way for you guys to make the thought process of, can I treat this and will the prognosis be good? Will I get a functional half out of that ewe? Because the big thing is, if I lose this udder, half of it, now you have one teat. And you're trying to lamb more than one lamb a year, hopefully out of your lamb crop per ewe. And if we're aiming for just one or more than one and they only have one half, you might end up with more orphan lambs. So mastitis can cause pretty significant damage depending on what bacteria is present. But what we're looking for are signs that you guys with any sort of infection, right? You're looking for heat, you're looking for swelling, you're looking for pain in the udder, you're looking for how, cold or hard it is. I do that by physical palpation because sometimes, especially in our wool breeds, you can't always see it. Generally, if you're flipping them up and you're looking at them, you can. But if you're noticing like a color change or loss of symmetry, right? One half is looking weirder than the other one. That would clue me in on, I need to look at that milk. I need to feel that udder. I need to see, does that animal look septic or is she off feed? Particularly one thing that I actually learned from a lot of sheep producers that as a vet student, I never thought about until you go work on, I was like 30 out of 30,000 ewes up in Wyoming on a lambing rotation up in Colorado and Wyoming. They said, oh, you just find the skinny ones. You'll find the mastitis. And I was like, skinny what? The lambs, the moms won't allow them to nurse. And so when they're got mastitis, they don't want the lambs nursing off of that affected quarter, or sorry, that affected half because it hurts. It painful. They don't want to be activated with that. So the lambs are headbutting everything except the teat because mom keeps kicking them away. They told me to look for the skinny lambs because they look sunken, they're hungry, they're walking around, they're trying to nurse off other animals. And that's because mom won't let them nurse. And that is one of the signs that we look for when we're trying to identify which of these ewes might have mastitis, particularly find the lambs. Chronic mastitis is probably one of the more frustrating diseases for me when we're classifying how this mastitis occurs, because this one generally has a decreased yield, but they're not always inflamed. They're not red. They're not screaming, I've got inflammation, please deal with me, right? So they're usually, the lamb growth rates, when we see these guys, they're not growing as fast. They're still growing a little bit, but the milk production in that half is just dropped significantly because of that inflammation. When you've got that much inflammation, the bacteria that typically is causing mastitis releases a lot of endotoxin. That endotoxin causes all these immune cells to destroy the tissue that's making the milk. If you do that chronically over and over and over again, eventually your body's like, whoop, I'm going to wall you off and just ignore you, and decreases the amount of functional tissue that's within that half. And so my goal is to find them acutely, find them quickly, and treat them quickly. Because if I can decrease the incidence of that chronic inflammation within the udder, I'm hopefully aiming to get a functional half back for the next lambing rotation. Particularly what starts to get a little bit from these chronic mastitis, things that I start worrying about, depending on the bacteria that's present or the functionality of the tissue itself, is these formation of masses or abscesses. We've all seen lymph nodes like CL or things that are in different places around the body for small ruminants. Sheep tend to have more lesions on the inside. But one of the things that I like to point out, particularly for producers, anything that looks lumpy in an udder is potentially the udder tissue itself. But there's a ton of lymph nodes that live in this back area near the udder, and those will actually swell up and feel pretty hard. And so when you start seeing those, that means that we've had some sort of inflammatory process or even a bacterial infection ongoing for a relatively longer period of time, meaning that that tissue might not be as a prognosis, might not be as functional as an acute mastitis if we can get that treated quickly. The problem for me as a veterinarian, when I see things like this, where they've got the lumps, they've got inflammation within the cells, but not maybe on the external side, is treating abscesses that are deep in the infection in the mammary gland is quite difficult. Because if we go back, and I'm going to slide for you guys, here, all these lumps and bumps are happening up in here. I can easily, if you guys treat mastitis, most of the time we're using an intramammary tube, right? We'll put the tube here, it'll push the drug up into here, and this is kind of where the drug sits. Now, if I've got infection in here, that's great. That is a high drug concentration, exactly where the bacteria lives. I'm going to kill that bacteria, hopefully. The problem with these chronic ones is this gets smaller, and the infection proliferates and gets a lot larger within the tissue, but I'm putting the medication here, and that medication, if you look at the tube, it's actually like an oil-based typically, and it likes to sit right here in the cistern. All of the medications that we have to treat mastitis are extra label because they don't have anything for sheep and goats. And so these aren't formulated to get all the way up in the parenchyma of these tissues. And more importantly, once the bacteria sets up shop and makes that wall of an abscess, getting medication into something that is walled off, quite difficult. And so treating these are usually unrewarding in that chronic state. Yeah.
What is extra label?
Yeah, so extra label, the question was, what is extra label? So when we have drugs that are approved for like dairy cattle or beef cattle, those went through a safety and efficacy process by the Food and Drug Administration to be approved for use in that species. So whether that be a beef cow, a goat, we got a few sheep ones as well. When you use something extra label, that means if you flip over, let's say a bottle of oxytetracycline or that injectable antibiotic, and you don't see what you're treating on there. So you're giving it for a different indication or disease process. You're changing the amount that you give. Let's say you're treating a random species like, I don't know, I've treated an antelope once. They don't have medications for antelope. That's all extra label. And so you can't just do that without some sort of veterinary description. And so that's why it's relatively hard to figure out how I'm going to treat this if you don't have any veterinary involvement. Unfortunately, the FDA made that quite difficult for small ruminant producers in rural areas if we don't have enough sheep vets. I promise I'm working on getting you guys more sheep vets. I'm trying really hard. You guys, I got a proposition for you at the end that you guys might be able to help me with. That's a great question. Sorry, I am a pharmacologist, so that definitely is my bias. I forget sometimes that I just get so excited about medications that it just drives right over my head. So subclinical mastitis, this one is the harder one, in my personal opinion, to detect, right? So you've got acute, which is screaming with a red flag, hey, I'm inflamed, I'm hot, I'm infected, please treat me. You've got chronic that goes, well, you didn't treat me, and now I'm just sitting here and screwing up all of your udder. I'm hard, I'm small, I'm not making a lot of milk. The subclinical ones are the ones that get quite frustrating because externally, when I'm looking at that udder, it doesn't necessarily look inflamed. It might not cause any sort of damage on the outside of the udder, but you're still seeing that chronic inflammation that eventually might lead to that chronic mastitis because you're going to see generally a reduction in our milk yield. And you'll generally, the first sign of some subclinical mastitis in these guys is the lambs aren't reaching their target weight, weaning weight. And that's because the milk quality is just not where you want it to be. So the amount of components that you're hoping for that you're growing your lambs on just isn't meeting what they need. And so the hard part is eventually subclinical can turn into lumps or scar tissue, these in the udder itself. And sometimes eventually you'll hear this is called hard bag. When I made this presentation, it was quite fun to see where I use the hard bag or blue bag or lumpy bag or whatever term that you use interchangeably with a lot of different things. So I hurt hard bag because you're going to see that word again when we talk about OPP. Because one of the things that using things like hard bag, to me as a veterinarian, that can mean a lot of different things. But if you go online and try and figure out like, oh, my sheep has a pretty hard udder, it's not working, what could it be? This is definitely one of those things. But I try to warn people, like, don't get blindsided and forget that there might be other things that could be causing this too. So the next thing we've got is, for me, I can't enter a Dr. Weaver invited presentation without saying nutrition is important, right? So if you guys know, as you guys have heard many times, I'm sure, nutrition is the foundation of all medicine. I'll admit that as a vet. I can't do my job if the animal's not eating a good nutrition, because they're going to see a lot more of me. And let's be real, when I get back to the basics on most of small ruminant husbandry, what does it come down to? Nutrition, right? And that availability, and obviously management too. But I try to make sure that my producers know that you have to make sure that your ewes are getting the nutritional components they need. Again, that is my welcome to my nutrition talk. That's it. Here's Dr. Weaver, right? So for me, one of the big things that from a health perspective, when they're a good body condition score, when they've got an adequate protein intake, when they've got good nutrition and they're coming into lambing, they will generally have a much better time fighting off infections. It has been clinically shown if you enter into lactation with a very low body condition score, let's say pretty thin, 1 or a 2, you're not going to have the energy reserves, 1, to make milk, so your lamb crop will suffer. But more importantly, it's physiologically hard to fight off infections when you're just trying to survive, right? The protein, the carbs, all that energy source that normally would go into making your immune function, your milk, is now just trying to keep your cells from crapping out. They're just trying to survive. So for me, what I want to make sure we harp on is that if we're lambing, it might not just be an infectious problem. We got to look at our nutrition too. Particularly for me, the other component is you can't medicate your way out of bad management. So hygiene is really, really important. So looking at where you're lambing out, where they're housed together, what's the stocking density, all of those can play a pretty significant role in how mastitis spreads, how it occurs, and in particular, which pathogens are we most worried about? Any questions so far? Perfect. So for what I wanted to do is just go through quickly. There's a lot of different mastitis pathogens, and if you Google it, it is actually an obscene amount of things that we have cultured out of sheep and goat milk. But for me, one of the most common ones that I isolate when we do a milk culture is Staph aureus, right? You guys have heard that one. And coagulase negative staphylococcus, Mannheimia, and Pasteurella might sound familiar. They're our most common respiratory bacteria that we see in our lambs. The reason why that is on there is because when the lambs, if they have any sort of respiratory disease, we have cultured this bacteria out of the milk of the ewes because they're being exposed through the suckling of the lambs, and it's actually going up into the udder and causing a mastitis. Not nearly as bad as like a Staph aureus or an E. coli or something like that. But particularly when we're isolating those, I keep those in the back of my mind. You can't just look at an udder and go, that's Staph aureus, or that's coagulase negative staph or CNS. Oh, that's E. coli. I can probably guess because unlike cattle, these are the major ones that we see in culture. However, you never know without just looking at it. It's kind of like if you see diarrhea, I can usually guess it's parasites, but then I check a fecal and it might be coccidia and not nematodes, right? So just because it quacks like a duck and it might be a duck, it's probably a zebra. Let's be real, it's me. So one of the things that I typically recommend for mastitis cases, particularly acute ones, would be to milk culture that. And I think it's important to know, like the hard part is I'm going to recommend that you milk culture it. Well, if you milk culture it, that can be quite expensive. I looked up Rollins today to make sure that I was not lying to you guys. They need about 5 to 10 mils of milk. You can submit it to them. The test name is Ruminant Mastitis Culture. It's $6. That sounds like a pretty good investment to get a decent amount of information. And I think the accession fee, I can never figure out what their accession fee is. I think it's like $5 or $10. It's $2? Okay, that's a steal because I think my phone costs more for me, you guys to call than to actually send off the milk test. I will say the limitations of this is perfect information to have, but again, we talked about earlier extra labeled drug use. Like let's say you identify one of these pathogens, you have to get that medication from somewhere. So just having the culture doesn't allow you, unless you have a veterinarian that's associated with your farm that's willing to write you prescriptions. You can't just go to the feed store and buy an intramammary tube, right? So, but for me, as somebody who is, I'm a vet that really is trying to be conscious of the fact that it is not cheap in this economy to raise any livestock, let alone small ruminants. I try really hard with my producers to find them the ways that I can get the information I need without them selling off half their flock, right? So if they're having a bunch of mastitis outbreaks, I'm going to have them collect milk cultures. I'm going to teach them how to do it sterilely. And then I'm going to ask them to send me that information and we can come up with a game plan for them. My goal as a veterinarian, and I will say not every vet probably matches that, but I really want to make sure that they are self-driven, that they want to do as much as they want, and then I help them get where their goals need to be. And I think having that discussion, just a plug for veterinarians, have that discussion outright with your vet. Like, how much do you want to be involved? There's some herds, they don't want to do their milk testing. They want me to just do it and interpret it and give them the results and tell them what to do. A lot more of them would like to do this themselves and then consult with me, and we partner with them to make sure that they're getting the best care as possible within, honestly, the budget that they work with. And since I work for the state, this becomes a lot more fun, and I can really work with people doing this. So if you're ever in need of a consult, let me know. I can't necessarily prescribe you drugs, but I can at least help you find a vet that might be able to. So what does this look like? I will say, I just said you can't identify bacteria based on what the udder looks like, but there's a couple pictures here that if you Google Staph aureus, here you go. This is now blue bag, right? Blue bag means that the tissue itself in the udder has started to necrose, lose blood flow, and honestly become necrotic. So if you have an udder that looks like this, that means the cells within that half of the udder, and potentially the other one is coming, is very likely on its way out. I have seen animals survive this with systemic treatment, and that udder in about a month or two will fall off, that half. Because it is necrosed, the blood supply has gone away, and that tissue is basically dying. The animal has to survive that necrosis, because if you think about all this tissue damage, that is usually from a bacteria, gram-negative, honestly, or Staph aureus, which this one's gram-positive, but they can release endotoxins that kill the udder. But if you think about those endotoxins, they get absorbed into the bloodstream that can then go into the animal and cause that septic animal, the one that's down, the one that eyes are bloodshot. That can kill an animal relatively quickly. If I start seeing this as well as a systemically ill animal that's down, not eating, has bloodshot eyes, I probably need more intensive treatment than just an intramammary medication to fix this. I will also tell you, if you get to this point, intramammary tissue is not going to bring the blood supply back. So my goal is to identify early inflammation, not black inflammation, right? Because this is the part where that tissue is going to slough off, and no amount of anything I do as a veterinarian, except maybe take it off in surgery, is going to fix this, right? Particularly for Staph aureus, it is a contagious pathogen. And that's really important because when we're talking about which pathogens are affecting our herd or our flock, I need to know, is it contagious from animal to animal, or are they picking it up from the environment? This is one of those that you'll see it's called a contagious pathogen. That means that when you've got lambs that are jumping from ewe to ewe, they could be easily passing this Staph aureus to them. If we have any people that milk sheep, you could very quickly spread Staph aureus into other animals through your milking machine. That's one of the most common ways we see it in our dairy herds too. For me, treating Staph aureus is usually unrewarding because this bacteria, a fun fact about this one, and I hate this bacteria, it likes to cause micro abscesses. And so that means when this bacteria goes up into that street canal, sits in the cistern and gets into that tissue of the udder, it starts to make little pockets of abscesses all throughout the parenchyma of that udder. Once you've got abscesses in the tissue that's making the milk and you do that chronically over time, we're going to move into an udder that looks like this, that's not making any milk, that's very inflamed, and eventually will necrose and fall off if they survive. And that to me is one of the most frustrating ones because this can be subclinical that turns chronic, and you might not see this until it turns into that. So again, how are we supposed to identify those is obviously one of the hardest things that you guys do because I'm not flipping every sheep over to look at the udder every day. But you try and pick up on those signs like the thinner lambs or, she's not eating as much, she's not feeling good. All of those things play a role. The other, I put blue bag again, right? It's back, because when you say blue bag, I don't know which one we're talking about, but this is the udder I'm looking at. That's the udder I imagine. E. coli is one of those gram-negative bacteria that is from the environment, because I've now learned that E. coli just covers everything in the world, right? The whole world is covered in a thin layer of E. coli. It's just how much we get infected with. Particularly for E. coli, it also is a gram-negative that when it is killed or it enters the bloodstream, it can also release that endotoxin that will cause that necrosis to happen of the mammary tissue. Particularly for me, this is when people call me and they're saying, well, I have blue bag or I have gangrenous mastitis. This is usually the one that we are isolating when we're culturing that milk. And I have to be very cautious because that is a bacteria that very quickly will make an animal go septic. And usually the timeline from presenting with this to sepsis is 24 to 48 hours. So I have to be relatively quick on my treatment recommendations because I need to either figure out how to stop the infection here, but more importantly, that toxin that bacteria is producing can get taken up into the bloodstream and cause a lot of systemic illness and really kill them pretty quickly. So again, how do I, as a veterinarian, train you guys into what to look for and how to prevent some of these things from happening? The first big thing for me is any sort of udder change needs to be examined, right? If they're walking out in the field and you see a little abnormal symmetry, we need to go look at that animal. If you notice any heat, any redness, any swelling, any sort of pain, one thing that I started, I know I spend a lot of time looking at sheep and goat udders. They kind of walk, they have a big udder, like the goats that I work with, a lot of them have big udders, but when they've got mastitis on one side, they actually look like they're lame. And so when I go, because that udder is red, it's hot, and they're trying to keep off of it, they'll actually move their leg on that affected side a little bit differently. So that's one of the things that I tell owners to look at. Any sort of asymmetry, one half is bigger than the other. Any changes if you're milking them or if you're going to look at and you're like, is this one actually mastitis? I'll actually try and milk out a little bit of the milk. I'm looking for things like clots, flakes. What's the consistency? Is the water or is the milk kind of watery? Is it red or clotted? That blue bag that you guys saw over here, when I milk something like that out, it's usually bloody because the tissue has been sloughing and it's all within that cistern is all inflammation and generally a little bit of hemorrhage because that tissue is just so unhappy. Any sort of milking of that tissue actually causes that irritation to slough and cause pretty good amount of hemorrhage and blood. Now, obviously, if you have mastitis, we're going to notice, we're going to see a reduced yield, but notice like actually quantifying that in our herds is probably a little bit harder to do. But other signs that you can easily take if they are septic. So if you see that they're a little off feed and taking a temperature and they're above, 104, I would be very concerned, and particularly in a lactating animal in those first 2 or 3 months, I would definitely want to make sure anything that I see that's off feed, I take a temperature because that's one of the first signs of a mastitis. And then obviously if the kids or lambs are not gaining any weight, I'm going to look at why they're not gaining weight. Is it the lamb's fault? Is it the ewe fault? And where are we missing that nutrition? Because generally it's usually the milk from them or coccidia. Like we won't even get to talk about coccidia. They're not gaining weight. That's one of the big signs that we're going to look for. So when we're talking about mastitis treatment, that's a hard one for me because a lot of the times when I'm doing this for dairy cattle, I've got about 3 drugs that I can pick from, and most of them will work sometimes. The hard part is when I am treating them, I don't always know what I'm treating. But I will tell you on the market today, we only have 1 intramammary antibiotic, and it is labeled for cattle. And it generally will work in sheep and goats too. However, you have to have a vet in order to do that extra label. You can't just go and buy that off the shelf and do it yourself. You have to have at least some sort of veterinary direction in how to use that. Now, for me, I think those tubes are not necessarily the cheapest thing ever. So that's why I think that $8 culture from Rollins would actually be very helpful. If you sent that to me as your vet, I could say, oh, that's not necessarily one I would treat because it's E. coli, it's Staph aureus. Spending almost $80 on treatment for this mastitis for this ewe is not going to yield what you want it to do. So maybe if your goal is to save the ewe, we can try it. Is your goal to have a productive ewe year after year? Maybe this isn't the one that we're going to keep in our flock. So then particularly, I always, if I'm doing like, let's say an acute mastitis, right? So that initial inflammation, it hasn't started sloughing. We're just now noticing it. I usually will start with just intramammary antibiotics. And I will tell you, I say antibiotics, there's only that one that's on the market. kind of shoots us in the foot a little bit as practitioners and as producers, but that's where we are. So I usually will do that either a full tube or a half tube, depending on the size of the goat. But I usually am Hail Marying it in a goat that's pretty sick. So I will usually put that whole tube in there. And then if they are sick, so if they are systemically ill, so if I'm looking at their the whites of their eyes and they've got blood vessels that look really red, if they're off feed, if their ears are down, if they are looking sunken in, they're showing signs of sepsis, I will treat them systemically as well, because that medication, when you put it into the udder, generally is formulated to just stay in the udder. But when you're septic, that barrier between the blood and the udder has actually gone away. And it's now that toxin is going into the rest of the body, and the bacteria. So I need to give, in addition to an intramammary one when they're really sick, a systemic one to cover the bacteria that's now moved from the udder into the bloodstream. And you'll have a higher chance of saving them if you do that. And I will tell you, I've learned that from, I'm sure, this is no credit to NC State, I'm sure they taught me that originally, but I actually learned that in my first year in practice when a goat producer told me, hey, you need to remember to treat it systemically. It's also sick. I was like, crap. So I've been humbled quite a few times graciously by learning a lot from producers. And so my goal is, if you see a veterinarian that just treats antibiotics intramammary and you think your animal is sick, you could always suggest, nicely, potentially a systemic one, particularly for ones that are down and out, because those are the ones that I'm really worried might potentially pass away. Obviously, I also worked for FARAD. If you guys haven't heard of that, it's the Food Animal Residue Avoidance Databank. So I had to put that on there. Make sure that if you're using them for meat or milk, or if you're selling them for production purposes, make sure you follow withdrawal times that are longer than what's on the label, because nothing's really labeled for sheep and goats, so you have to extend it. In case you didn't know, FARAD actually lives at NC State, and I am FARAD. So if you have any withdrawal time, you can call me and I'll help you out. Again, I harp on this one because I think sometimes I deal with a lot of pet goats, and no, there's nothing wrong with that. I actually enjoyed them graciously, but when you start getting these chronic Staph aureus cases, that's the bacteria that likes to set up shop in micro abscesses in the tissue. I cannot, as a pharmacologist, get enough drug into that animal to treat and make that go away. It's very good at evading my drugs. And so I generally will start either recommending culling them, or even if they're septic, taking off that udder, because they're not going to be easily treatable, and they're generally not curable with mastitis. So we'll move on to make sure I have enough time to cover. But the second part of our discussion today is on ovine progressive pneumonia. And everyone is probably staring at me going, why in the world are we talking about pneumonia? You just told me it's an udder problem. Yes, I Googled it to make sure, but I'm just kidding. So this virus is actually probably, as somebody who does a lot of sheep and goat work, the lentiviruses that this particular virus is in is the most frustrating thing ever. Have you guys heard of CAE? Right, the caprine arthritis encephalitis virus, that is very closely related to OPP. OPP is the ovine progressive pneumonia. They're both Mastitis virus, this is what we call it in Europe. And these are the chronic wasting diseases of our sheep, and very similar to our goat diseases with CAE. This causes generally a couple of different things, but in sheep and goats, in sheep, it's generally a mastitis or a respiratory or pneumonia. And it causes a pretty significant inflammatory response within both of those organs. And this is where I'm going to bring the term of hard bag back, because this is also hard bag, but I told you that the lumpy Staph aureus might also be a hard bag. Yes. So I can't generally say if it's bacterial or this, but if I have a sheep that presents to me, is systemically relatively healthy, has a very low producing udder, even though she's in the height of her lactation, and when I say hard to the touch, it feels like an overblown basketball. It is very hard and very, like I can't usually I can squish an udder when I push on it. This is like hitting an overinflated basketball. It's quite hard. That's because the white blood cells, particularly in the udder, actually cause a pretty severe inflammation that destroys, again, the tissue, but not necessarily the blue bag tissue, right? So it's not causing an endotoxin release. It's just chronic proliferation or growth of those tissue cells, so you don't have any functional milking tissue left. So you'll lose that, you won't lose the udder per se, but you'll lose the functionality of it. So it particularly for me, the biggest thing that I point out with this virus is it's a long incubation period. So if you get infected as a lamb, I likely won't see it show up in a herd until those lambs are 2 to 4 years old, because it is a very long history of hiding from the immune system and becoming reactivated. But they can shed it at any point in their life. But generally, we're looking when they're going to pop positive because it hides from the immune system. They're going to be positive around 2 to 4 years. And I will tell you, the mortality rate is very high. It's almost 100%. And usually when they're showing signs of that chronic wasting, their mortality is usually within a year of those clinical signs. They can live with OPP, obviously, with being 2 to 4 years before they're showing any signs. But the problem is once they have those signs, you can't treat it. And it's very honestly hard to diagnose. And you'll do mastitis, you'll do milk cultures, nothing will come back. And you still have a non-functional udder. Yes, I have a question in the back. Yes. Yep. We'll talk a little bit about that as we go. It's usually from kids and lambs when they're commonly early in life. That's when they get infected, right? So the way that kids and lambs mostly get affected is through the milk and colostrum when they're very, very young. You can have, if they're shedding live virus, respiratory secretions, but that's not the most common route of transmission. I've also seen they've done studies where they look at contaminated hoof shearing equipment and used needles. The biggest pet peeve of mine, I'll be honest with you guys, is when people put a used needle that they inject into an animal into the top of a drug bottle and leave it there. Don't do that, because that obviously can introduce bacteria into what should be a sterile bottle, but it's also a good fomite. So it can also transmit and harbor things like this virus or other bacteria that can be injected into other animals. One of the things that you guys are going to look for when I'm examining this animal, when I'm training people, is it's usually a hard and non-painful. So if you feel a mastitis udder, it is red, it is inflamed. If I push on it or even milk it, they are trying to knock me in the face. With hard bag or particularly with OPP, they are not usually that painful. It's just really, really big and really, really hard to push on. Usually you'll see poor kid lamb growth again, and weight loss or respiratory disease in some of these older animals. Again, those are our main clinical signs. A lot of things cause weight loss in small ruminants. A lot of things cause respiratory signs. So this is one of the ones where, as a veterinarian that does sheep and goats, I try to look for it, but the tall tail sign that I need to be testing for it potentially is when I see that hard bag in a lactating ewe. That's like my first clue. Or if I'm getting abnormal lamb growth with those weird udders, I'm going to screen a herd for OPP. Now, I bring this up because I think and I do a lot of mixing up and with this too. When I have goats and sheep, this is a very similar related virus to our caprine arthritis and encephalitis. But the way I try to remember it is when you've got lungs or some sort of respiratory disease, OPP primarily affects the lungs and the udder. Okay. When I have CAE, people forget, but you can have CAE actually infect the udder and cause a sterile mastitis, or one that when we do a milk culture, it won't have any bacteria in it. But in young animals or older animals, I'll primarily see it show up as swollen joints, particularly in the wrists, as well as OPP and CAE have been indicted in actually encephalitis within the brain itself. So if you have neurologic goat kids and you have a history of OPP on the farm, that is very likely the similar virus that could be one of my differentials and cause one of those things that could be causing that disease. Again, frustrating to know that they're all causing similar signs, but that's kind of how in my brain, when I'm trying to figure out what type of animal do I have and what disease process is going on, this is how I separate them out. So the way that works, because I told Dr. Weaver I was putting a macrophage in here, I went through, you guys will all probably laugh at this. I'm a nerd at heart. And so when I made this slide, I started going here and I drew a line, and then I was like, interleukin 2 activates this macrophage. And then my husband, who thankfully I'll just have to give him some credit, said, that's a lot, make it better so normal people can understand. And so I took the lines out and just wrote monocyte to a macrophage. So you've got this virus, you get it from milk and colostrum ingestion as a kid, right? Or I will say, I won't rule out inhalation because it's progressive pneumonia, so they can shed that virus. They get activated within the macrophages, and macrophages live in the lungs and they live in the udder. And so that's where once you activate this, they turn into a macrophage, and then they cause respiratory disease depending on the age or mammary tissue inflammation. But I had to throw out a macrophage because I'm a nerd. So When I talk about testing, so now I've told you a little bit about the differences that we're going to see. How do I test for this, and where do I send this, and how do I go about designing a protocol in which I want to test it? The most common way we test it is a serum-based ELISA test. Who am I testing is probably the bigger concern, right? So when I'm looking at testing my herd to get I'm aiming now for a negative flock. You want to test weaned replacement lambs. You want to do yearlings, but generally I try to do yearlings that are not cohabitating with ewes, because if my ewes have OPP and it's respiratory, they very likely could also spread it to my yearlings. So I want to keep them from that flock separated. And then in particular, if you have any ram or ewe that you bring in from an outside source and you don't know their OPP herd status, I would test for this virus, because this can decimate a herd, but you're not going to know it for 2 to 4 years. And so that becomes quite frustrating if you're switching rams every couple of years for your lamb crop and you don't realize until about 3 or 4 years into it that now all your ewes have OPP. That can be pretty devastating for a flock. Now, again, the limitation is if they ingest that colostrum, I can't test them 2 or 3 weeks later, right? This is one of those viruses that's going to take a long time to show up, but it might not cause any inflammation until a couple of years down the road, but you can get an antibody response to the virus. So I always tell my owners and producers, start with 6 months of age, and then you're going to test yearly, particularly if you're trying to cull out your herd without just getting rid of everybody and starting again, because that's not a good use of your money either. But if I'm trying to be aggressive, it depends on how aggressive you want to be. But after my lambing, I usually will test starting at age 6 months. I'll test every 2 to 3 months, because if they're negative at 6 months, that does not mean that they're negative for a couple of years. It all depends on when that virus activates and actually becomes available to activate the immune system. So I'll usually test every 2 to 3 months after I get an initial 6-month negative. Now, if they pop positive at 6 months, I can almost assume that the sibling, if they have another lamb, is probably positive as well. So that's one way I can work with producers on decreasing the cost of that. But I generally say when you're trying to control and manage these guys, anybody that comes to your farm needs to be quarantined. I used to tell people 30 days, but this is one of those that I generally will tell you at least 60 days and do the test on arrival and a test at the 60-day quarantine, because then if they're adults and you've got a new one, you've got a negative and a negative, that decreases your potential that they're going to be shedding that virus. I will say I will give you a caveat. One of the hard things about show animals is they can become infected at the show with this particular virus and it might not show up. So I'm very cognizant of the fact that it's very not as common as ingesting it as newborn kids, but I won't rule it out if I have a show animal that is going out to shows and being potentially exposed to other flocks. They could pick up this virus at a show. So that becomes, everybody gets respiratory disease when they come back from the show, but usually if it's right after the show, it's not going to be OPP. But this could show up down the road in a longer period of time. So I thought a chart might help when you're trying to differentiate between these two, right? So you've got mastitis in red. The cause is almost always bacterial, but not every time. But it's often painful. It's often red, inflamed. You'll usually see changes in their milk, usually with clots or an abnormal color. It's often, honestly, quite treatable if you have that acute phase where you're deciding whether or not to give it intramammary antibiotics. Those can generally be treated relatively easy with good success. Not zoonotic. So that means that if you're messing with that milk, generally you're not going to have an infection that crosses between the sheep and you. And the control generally is treatment and hygiene and udder hygiene. So making sure your milking equipment or even the lambs aren't able to run from you to you until that actual mastitis is cleaned up. OPP is the other one, right? So that's usually the viral infections. That is usually, I will say, non-painful, not red, but a big hard bag. They usually have low to no milk. And once they get to that point where they've got that chronic inflammation within the udder tissue, you won't have any milk-producing tissue left. And is this treatable? Is no. We can't get rid of this virus. They are lifelong shedders, and they will usually succumb to this disease at some point, whether it's their lungs with pneumonia or within their udder itself. And the only way to kind of control this is to test and cull, depending on what your goal is for your herd or your flock. So if you're looking for my practical Dr. Mzyk take-home messages, right? Obviously, I don't have to spend too much time, but if you're milking them, you need to make sure that it's clean and it's consistent. and we're trying to avoid that cross-contamination, particularly in dairy breeds. You're also looking to monitor your lambs and your udders routinely. So the worst thing you can do is just go out on pasture and assume that they're going to be all right. I like to tell my producers, you should at least go look at them. Who's off by themselves? Are they flocking together? Sheep are adorable, but they're not that smart sometimes. And so if there's somebody over there by themselves and their lambs over there screaming, I'm going to go probably look at that ewe. If you have a suspicion of an acute mastitis, highly recommend culturing it because it will give you an idea of what type of bug you should be able to treat. And let's say you get no growth on it, that might clue me in to potentially look for OPP or something like that. If you're getting new animals or if you're trying to be more aggressive on your culling and your decision-making on who to keep in your flock, I would potentially recommend if you're seeing signs of either OPP or CAE, I would know your herd status and get a baseline to figure out what that is, particularly with starting with your older ewes and trying to see if anybody is positive, because if they're going to be your breeding animals, I want to know if that colostrum is actually being contaminated and then passed on to our lambs. I say don't ignore hard bag animals because that can be very quickly changed from an acute mastitis to a subclinical or to a chronic one. Or if you're looking for OPP, obviously one of the more production problems where you're not going to have any milk. And then I can't, I'm a vet, so obviously I'm a little conceited, but working with a veterinarian to try and come up with these herd health plans. We are working very hard to try and extend our range at the College of Veterinary Medicine to help, honestly, the North Carolina sheep producers. That's a goal of mine, working with Dr. Weaver and the Extension Service to try and help you guys identify and train new veterinarians. So I told you I'd put in a plug. If you are willing to have students come out and learn how you manage your flock and what you want out of a vet, I will give you my email at the end of the slide. Please email me. I'm more than willing to make field trips because I want our students to be comfortable working with sheep and not just pet sheep, but producers as well. So I want to be able to make sure that you guys know that we're working really hard to train North Carolina veterinarians to do sheep and goats. I'm trying with Dr. Weaver and Hannah's help, of course. So this is my email address. That's my NC State one. You guys are more than welcome to send me an email if you have any questions, concerns, or thoughts. And if you need or are interested in our field service, I'm more than happy to come out as well. We're typically within an hour or so out of the vet school, but if you give me enough notice and you have a cool operation, or if you're really willing to teach students, let me know, and I can probably organize a field trip to come out and see your farm too. And with that, I'm more than happy to answer any questions in the room, and then once that's done, we'll move to the computer. That sounds good? Yes.
The conditions you're describing, do you need to call the animal? Like if they haven't had any medications, could you still harvest them for meat, or is it not safe to consume the meat?
Yep. So the question was, if you've got an animal that either has the acute mastitis or let's say OPP, and you want to maybe not sell them, but consume them for personal consumption. Yes, it is. Once you cook it, they're kind of destroyed, generally, as long as you haven't treated them, obviously. Mastitis, it depends on like if you're gonna home slaughter or send them to slaughter. Because generally I will say most people would probably not want to eat the sick goat or sick sheep personally, but it really depends on the operation and the personal taste of that. But generally you're not really worried about that cross-contamination between when you slaughter them. So I'd be willing to eat it. Mastitis for me make hit or miss, but it's not like a zoonotic concern because you're going to cook that meat. And the virus is not very hardy.
Recommend before bringing animals to your farm, other than you.
Yeah. Yeah. So the question was, is there any other like biosecurity testing that I recommend before bringing a new animal to the farm? Yeah. There's a couple of different ones, depending on where you send it. There's different labs that either need a vet or you guys can draw blood and send it yourselves. But I always screen for CAE. The CL, which is caseous lymphadenitis, I like to screen for it, but the test is not very good. So if I get a negative, doesn't mean that they're not negative. It just means that their test didn't work or they're not shedding that amount of bacteria in that animal. I honestly do a fecal test. That's a very easy one to know, especially if I don't have any deworming history on that animal. I want to know, are you shedding a bunch of parasites before I throw you in with my flock, who's been relatively well managed? And then what's the other one? I usually do Q fever as well, because I don't want things that are going to decimate my herd right off the bat. Yep. Good question. I think we had two more over here. Yeah. No.
Sterile container culture, are you talking like red top and purple top foods that I would send blood in, or how would you try and take
Sure.
as sterile a sample as possible, right? You're
Yep.
milking it, an animal that doesn't not even know.
For sure.
It's gonna be messy. How can you do that the best way?
Yep. So the question was, how do I get a sterile milk culture? So what I typically do is I get an alcohol wipe. Usually you can buy like literally over the counter at the first aid kits. I will actually clean off the udder, and then at the very tip of the teat, I will wipe that off with alcohol, let that sit for about 10 seconds as I'm like holding the base of the teat, right? So then I use a red top tube, or you can order sterile milk vials. The goal is once that top comes off, it's almost not sterile. So I try to wait to the very end to take that red top off. But red top tube is perfect. There's no additive in it. I take that off, and then I do 2 squirts of milk outside of it, like away. And then I milk about 5 to 10 mils, which is like 2 to 3 strips into that udder or into the tube. And then I put that top back on, and that's perfectly sterile. You try, if anything gets on the outside, that's generally okay, but I don't touch the tube to the udder because I have had false positive contaminations for other weird staph or streps because I touched the tube, and that lives normally on the skin. So I'm trying to identify obviously the one in the udder. And since, it kind of, the skin everts and goes into that, it's not uncommon to get that bacteria up there, but I try really hard to make sure that I use that alcohol wipe at pre-stripping, cleaning, and then doing the alcohol, letting it sit is the best way you can kind of eliminate the high contamination levels. But the red top is perfectly fine. I don't do a green or a purple. They have additives in it that will not allow you to culture that milk. But the dairy ones that people have, like the plastic containers, don't. I've had a couple people submit plastic bags to me. That's not sterile. I probably did okay. I almost wanted to test it just to like prove a point, but the lab said no. So it didn't look like milk to them apparently. So that's a great question.
How much do you save up?
It's really based on how much I test for it too. I will say I actually saw a lot more of it in Wisconsin because I was testing a lot more of it. Most of the time when I get to a flock that has a hard bag, it's not every animal because not all, depending on the age of the animal, they're not going to show signs. But the incidence is I shouldn't make up a number. It's not uncommon to see that. But for me, the hard part is diagnosing it because if I have one with a hard bag, she's usually a chronic mastitis too. And so is she OPP or is she mastitis? What caused the chronic inflammation? Trying to tease that out becomes a little bit difficult. But for me, if I have one in the herd, very likely, especially if they're breeding within their operation, a lot of them probably do. And so I know like from a mastitis perspective, it's like 7 to 10% of our flocks have mastitis, but a lot of people don't recognize it until a little bit too late. But OPP is pretty prevalent within the industry for sure. I don't have a number for you though. You, Dr. Weaver?
I saw it somewhere and I was trying to remember what the number was.
Yeah.
Say it without.
Yeah, you're just like me. Yeah.
Yeah.
The hard part is like you have to test for it. And so like there's probably a lot of hard bags out there that nobody actually screens for that because if you get a negative, is that OPP? Is it not OPP? It becomes a little bit difficult. But once they're positive for life. So if you can get a positive, that would tell me that I very likely should screen and cull that animal. And I will say if she's nursed any lambs in her lifetime, that would make me test them too at 6 months or older. Because that's a very quick way to decimate the herd through that.
I think generally we see it more in confinement operations.
Yes.
Because there is that close contact spread where like in the southeast.
They're more spread out.
Grass based.
Yep.
So there's probably
I
not
agree.
as much worry about. I'm not thinking it doesn't exist here, but.
Yep. Because that's why I saw it a lot more in Wisconsin because they close them all in the winter because it's deathly ill up there and deathly cold. It's like -50 in Wisconsin. So I saw a lot more confinement operations up there, and that's probably why I'm a little bit biased in that because one, I wouldn't say there's more sheep. They just were all huddled together to stay warm. So, and we did a lot more testing of it up there. But you're absolutely right. The spreading out is a lot nicer for these guys, for sure. But everyone, I will say my biggest thing, even my vet students, I say OPP and they're like, oh, it's pneumonia. No, it's actually mastitis, but we call it OPP because that's the virus name, right? So just because you have pneumonia doesn't mean you might not have mastitis or vice versa. And so even though it's a pneumonia virus, it's purely because it causes inflammation in both of those tissues. It's kind of a misnomer, but great question.
All right, while we wait for more questions. Oh, Jesus, no. I forgot to mute that. While we wait for more questions, in the room, if the folks online want to complete the, poll, and the folks in person will pass out a sheet. If you guys could fill that out, let us know what county you came from. Let us know what other types of programs you'd like to see like this, any topics you're interested in. So we really, encourage and need that feedback from you guys. If you don't mind, fill that out real quick for us. And at this time, I guess we'll go, the questions online. Do you want me to just repeat the question to you and then you read it out, or do we try to unmute?
You want me to come over there?
Let's see.
Whatever you want to do. I don't mind.
All right, let me see if
Whatever's easier.
slideshow, and I think I can. Okay, let's see. All right, yeah, so for those of you online, I don't know if you heard me or not, if you could just complete the poll real quick and let us know where you came from, what other topics you'd like to see, and we're going to go ahead and start answering your questions, asking your questions now. So the first question we have is, what are your strategies to manage elevated somatic cell count in dairy goats that do not present other symptoms of mastitis? No elevated temperature, bacteria counts are manageable by PCR test.
So the question, I'll try and get it all for you.
It should be going through
Oh,
there.
it can?
So, yep.
Oh,
Mhm.
perfect. So for me, the hard part about somatic cell count in goats is they're automatically a little bit higher anyway. So a lot of the times you don't know what you don't test for. So knowing the CMT test for me is probably the hardest thing because it doesn't quantify somatic cell count. So it just is like purple sludge or not purple sludge. And a lot of goats that are completely healthy with a higher somatic cell count don't usually use that. That test is kind of irrelevant. So for me, one of the things that we can recommend is I usually culture if I'm suspicious of a mastitis, but in particular for me at dry off, especially if it's a lactating herd, knowing I aim to culture at the site or right before dry off, because that's the way you can kind of treat some of these subclinical intramammary infections. And knowing what you're treating and what could work potentially would help decrease that as they come back into lactation. The hard part is if they're not showing any signs, can we live with that high somatic cell count? I think it really depends on what you're doing, obviously, with that milk and that product, because it's going to affect things like shelf life and taste and all that too. But generally, if I'm most of the time, those subclinical infections, I'm usually treating at dry off. But I think the only way to actually know if you're actually dealing with an acute infection or just something that's sterile would be to culture and screen for things like CAE as well. Because any inflammation will make somatic cell count go up. It doesn't have to be bacterial.
Okay. The next question is, are dairy sheep more susceptible to certain bacterial mastitis pathogens than non-dairy sheep?
I would say yes, because their production goals are different, right? So if you're aiming for dairy sheep, you are generally seeing them every day, milking them every day, using milking equipment that can potentially harbor this bacteria. I wouldn't say like the environment that they're in, like the pasture or anything is relatively bad or worse, but generally they're aiming for a higher production. Their street canal, their gland is opening up more often and potentially aiming for a higher production, which leads them to a more susceptible pathogen ascending into the udder. I wouldn't say they're like the breeds themselves necessarily aren't, but their production goals are different. And so if you're in there with a milking equipment with, let's say, a dirty equipment, you're not going to be doing that. Pasture sheep aren't going to be exposed to that, right? So for me, one of the things that when I don't have that, I will say I don't have that many dairy sheep operations. I think there was one in Wisconsin that I dealt with. And they try to reach those same levels of cleanliness that they do in dairy cattle, because those are the ones that they're going to be a higher risk because of the fact that they're being attached to milkers or being hand milked and exposed to potentially more pathogens than just the lambs.
The next question is regarding the ruminant mastitis culture test at Rollins, but cultures are so slow. How do we get a ewe treated in enough time to treat the pathogen before we lose a ewe?
Yep. So that's phenomenal. That we deal with even as veterinarians, not just producers. That is a common it's frustrating as a vet, and I'm sure as a producer, waiting for me to call you back even with those results. So I will tell you, our most common pathogens is what I usually start treatment for. But if I can get that culture submitted and start intramammary treatment, because that's the goal, right? We don't want it to progress to systemic or sepsis. I usually will start them on treatment after I take the milk culture. Once that milk culture comes back, deciding how long to treat that animal will change based on that milk culture bacteria. Or if I get nothing, then I need to be looking for other signs of potentially inflammation or mastitis. We don't have many mastitis intramammary treatments. I usually don't take like random drugs that aren't formulated for the udder's pretty sensitive. And so I've seen people do weird things like Oxytet that they put into a syringe and inject up there. I don't recommend doing that because of the vehicles that a lot of these medications are put in. They're very caustic and the udder is sensitive. And so the mammary tubes actually are formulated to not be irritating to the actual lining of the udder. Whereas a lot of people, I mean, I've even had people stick needles straight into the udder and just inject it there. That generally ends poorly for most people. But I do start treatment after culture, especially if I'm worried about them going septic. Because it does take 2 to 3 days. You have to ship it, they have to plate it, it has to grow, and then they have to tell you and identify it. That can be, if you submit that on a Thursday, they get it Friday, you won't get it till Monday. That could be too late. So I generally will start intramammary treatment around my milk culture, and if they're progressing and showing signs, I will then add that systemic treatment on.
The next question is, what types of intramammary antibiotics are out there? This particular person doesn't have a small ruminant vet, so
Yep.
she was asking what types of products should she be asking her vet about?
Yep. So the main one will be Ceftiofur products. And so the ones that you'll see that's approved and on the market that's available. The problem is which products are available. Even as a pharmacologist, there's one. There used to be a whole different classes of antibiotics, but the one that I keep on the truck is Spectramass, and it's LC. So that's Ceftiofur hydrochloride, and that's the LC is the main part there. That stands in quotes for lactating cow, because that's meant to be given in the udder every single day to try and keep that drug concentration relatively high. If you get a Spectramass and your vet hands you one and it says DC, that's dry cow. You don't want that one because that's meant to be put in there and stay there. You don't want to milk that one out. So that's if I'm drying off an animal and I'm trying to treat a subclinical infection at dry off when they're done with their lactation, that's when I potentially would use that to clear up an infection. But if they're in an acute mastitis, it's called Spectramass LC, and that's the tube that we typically use. There might be other ones coming on the market that last I heard, but that's the only one even my vet truck can get is just that one.
This next question is very similar. They're saying that Ceftiflex has been hard to source even through our vet, and we like this antibiotic, and we have to use a systemic antibiotic because of the short withdrawal time for milking does.
Yep.
Do you have any insight into why this has been so hard to source?
Yep, the plant that made it shut down. And Ceftiflex, so there's a couple of different things that we can talk about there, but Ceftiflex is the generic. So the main ones would be like the labeled approved product, I think it's called Naxel, and that's Ceftiofur sodium. That actually is labeled for respiratory disease in sheep. Ceftiflex is the generic version of, I think, Xanel, which is similar to Ceftiofur, but it's been, I think, on back order for like 6 or 7 months. Like we can't even really get that one or Exceed or any of the other Ceftiofur products. One of them definitely had an FDA violation, so they had to shut the plant down. And if you only have that one particular medication coming from one plant, everybody can't get it. It's kind of like in the pandemic when penicillin went off and like everybody ran to the store to buy like 8 bottles of penicillin. I did the same thing. I was like fighting people off for it. I agree. Like that to me, the Naxel, the hard part about the Ceftiofur, that's one of the broad spectrum antibiotics that I use very commonly in small ruminants. One, because it has a label to treat them and we know what the drug is doing. But if you have that drug, it actually doesn't get into the mammary gland very well. That particular type of drug doesn't usually cross into the mammary gland unless that barrier like mastitis is broken. So if you're trying to get higher concentrations into that udder, generally that one is a good one to keep them if they're septic, but if they're not showing septic signs, I stick to just intramammary antibiotics. But if they're showing any signs, I do use a generic intramammary and an injectable as well. And that's the same class, both of those, the intramammary and that one, that's the same type of antibiotic. Hits them from both sides.
So next question is, does giving systemic antibiotics help treat mastitis that has not entered the bloodstream, or does it not reach the udder at all?
Yep. So some of the antibiotics do. And so I think the best common example, have you guys heard of telithromycin or Draxin? So that's a macrolide antibiotic. And the reason why I put like macrophage on one of these slides is because then people remember it. Macrolides or Draxin actually concentrate in macrophages. And so that particular antibiotic, if I'm treating, depending on what bug I'm treating, like a Mannheimia or a Pasteurella, that actually will concentrate very high levels in the udder tissue and in the milk. The problem is if you are milking them for sale or for product making, that withdrawal time in small ruminants ends up being like 60 to 90 days. So it's not if my goal is to sell a product from that animal, I'm looking at a very long withdrawal time. Ceftiofur products like the Naxel or the Ceftiflex, those don't, in healthy animals, does not cross the milk barrier. So you will not get high concentrations of those in a healthy animal into the udder. Nuflor is another one, the fluorphenicol. That one will also concentrate in the milk as well at relatively high levels, but that ends up being, again, like a 60 to 75 day meat and milk withdrawal time. So again, it really depends on, like, I don't not stop an antibiotic unless it's illegal. I do not, I have to tell you guys, I don't use Baytril because you can't use it extra label. That is illegal to do. But fluorphenicol, Draxin, the Cefiofurs, all of those are allowed to be used on an extra label basis. I just have to pick and choose based on the systemic concentrations, what I'm aiming for. But I will tell you, if they're septic with some sort of gram positive or gram negative, the Cefiofurs will get a lot of those. And so that's why a lot of people, and they have a shorter milk withhold, which is why a lot of our producers end up picking that one. Great question.
The next question is OPP contagious? And we already answered that as yes, but is OPP an automatic cull?
I think it depends on your goal. So if that test comes up positive, it's very sensitive. So that animal is positive. You can separate out the herds and you can take the lambs from, like, they're not going to get it in utero technically, but once they're born, you don't want them nursing off of mom. And so if you have an operation where you can separate them right after birth and be very quick, you'll have a bunch of bottle lambs, which aren't necessarily the most fun. They're cute if they're Dorsets, but not the most fun. I know I'm very biased. And black nose fillet, but I only like the ones that can't survive parasites. So that's my problem. So for me, one of the things that it really depends on the operation. And like, I'm not going to walk onto a producer's farm and like, you have OPP, you cull everybody, that's it. It really is kind of picking and choosing how we're going to manage it and using their expertise as producers, but also our experience with testing. What are the goals and how much can we spend to kind of be more aggressive or less aggressive? But the main thing is you can decrease that incidence in your herd if you can remove the lambs. But again, it's respiratory as well. So there's always a chance that if the younger ones are intermingling with those older ones, you could still get that transmission. So I won't ever say just separating them will solve your problem because it can obviously cause other transmission sites.
Before we answer any more questions in the chat, is there any more in the room here? Anybody thought of any additional questions?
So if you were treating ewes for mastitis and they still have lambs on them, would you pull the lambs off while the ewes are being treated?
I generally don't recommend that because usually if I can, I try to, at least if I'm doing the intramammary one, I try to give them like, I don't know, like 6 hours away from mom to because the antibiotic actually lasts about 8 to 12 in the milk itself, because then you're usually in dairy, what they're labeled for is they milk them out, right? 12 hours later. That drug actually converts into a different type of metabolite in the udder and then goes into the tissues relatively quickly. So I try to treat mom, keep her separated. I would say minimum of like 4 hours. Then the lambs can go back. Now, if they're newborns, that becomes a little bit more difficult, but I think they can survive 4 hours. Maybe not 6, but maybe 4. But yeah, that's a great question because once you put that in there, I do try to give it time to disperse. And once I inject those intramammary tubes, I do actually like bump the udder to try and mix it up a little bit, because sometimes if you only go in partially, it might just sit in the street canal and not actually get up into that. So I don't usually do the full insertion with that tube, but I try to push it up there and then try and bounce it around. And then I do separate, I recommend separating them for a few hours, but it really depends on pasture versus confinement, and they have a jug or something they can keep them in. Yeah. Oh yeah, so you're good. Yeah, absolutely. Great question.
Do you worry about those lambs passing the disease for use? Like,
Yes.
So when you separate them, you separate them both and then further separate. So it's not bumming off the disease.
Yep. The mastitis, depending on, and that's why culture is really helpful from a management perspective, because is it coming from the sheep or is it coming from the environment? Because like If I get a bunch of cultures from, like, let's say 2 or 3 out of my flock now have mastitis, one is E. coli and 2 are Staph aureus. The E. coli is probably from the management of the flock itself. The Staph aureus generally doesn't always, unless you're milking them out of the same equipment, doesn't usually transfer from sheep to sheep unless those lambs are cross nursing. That very likely could. Now, if you've got good nutrition, you've got all these good things going for you, they're more likely to fight it off. Not every animal is going to get Staph aureus if they get a mild cut or mild abrasion, but it's definitely something I would think about if I try to keep them separated, depending on what type of bacteria I've got. And it changes how I manage it, right? If I have a Staph aureus versus an E. coli, E. coli is from the ground. The whole world is covered in E. coli. But Staph aureus, depending on if that's what I'm getting, I try to minimize that contact between the lambs and other ewes.
And do you have any like success stories of people tackling OPP in terms of someone who didn't know what was wrong, identified it, and timeline for?
It took us a while. Yep.
Photo to then now
Yep.
it's seen on TV, it's in color.
Yep. The question for those of us online was, have I had any success stories in OPP? I will say it was a lot of time, a lot of heartbreak, and a lot of effort on the producer's part. I can show up and take blood and test and be done, but the producer had to make the hard decisions pretty quickly on who he was going to test and who he was going to keep, because I've had 2 flocks that have had it. One sold the whole flock because they only had I think 12, and they just wanted to start over, and they were like, I'm done with this. Another one wanted to be more aggressive because they just wanted they had a pretty it was like 200 sheep, and you can't, I mean, culling all of that is quite a loss to the operation. And so we staged that out where we did it every 2 to 3 months. Anyone older than 6 months got tested. And we did that I was in Wisconsin 2.5 years. I think they were still testing, but after about a year and a half, almost all of them were still negative, but they still had 2 or 3 positive ones, but they actually moved the OPP positives to a different flock. And so they were still productive, but they took the lambs off of those and then bottle raised them. So it became a lot more work on the producer because they still wanted, because they were high genetic value for some of their, I think they were Katahdins, but they still had that problem. And so it's heartbreaking in all honesty because you can't cure it. It's hard to detect. It takes their life eventually, and it's not something I can treat. So it really, he didn't want to cull the herd, and I agreed with him because his operation was crops and sheep. And so he ended up having 2 different herds and 2 different properties. And he slowly stopped as his lamb crop and his replacements got bigger on one herd that were known OPP negative. He would grow that herd and stop breeding these and using them as replacements. It definitely took a lot of testing, a lot more money than I probably could tell you what it was. But the testing, I didn't check if there is an OPP test, I think, at Rollins. But I told him up front, if you're going to be aggressive about it, don't half-heart it. Because if we test them and then only test them once, I just wasted your money. And so he was very adamant that and I taught him how to draw blood. And so that was one thing that I wanted to be clear with him. I don't want to just spend all your money, and I want to teach you how to do this, and you and I can work together. So there was definitely a few times where he needed help catching the sheep because he was alone. But most of the time I would send either my tech, and once he got comfortable drawing blood, he was great. And he would send me the reports every couple of months, and then we would meet twice a year and see what his flock was doing. So I try to work with what he wanted. I'd rather him spend the money on testing than having me come look at his sheep, because that was a lot more. I might be alone in that as a veterinarian. Maybe the dean's listening, but I was really hopeful. I'm really trying to make them self-proficient with a little bit of veterinary guidance is my goal. So that's how I'm training people. I hope that helps. We'll see if it works in a few years.
And for those of you who are interested, it looks like on Rollins, it's $1.70 for OPP testing.
Yep. And if I submit it, usually vets, if I draw the blood and I submit it, it's $10, $15. And so that's why I'm very adamant. If I can train you how to draw blood, sheep drawing blood is more just shave a little bit easier. But it's not if there's definitely ways that we made it work for him. And I think I only have that as a main success story because the other one just culled everybody. It's doable. It just takes a lot of planning and a lot of work on the producer's part. I can't take any credit for it. I just diagnosed it, and then it was on him. It was a good learning. As a new grad, I think that was my 3rd or 4th year in practice, and it was a very good learning and a humbling experience for me as a vet on how to work with producers in a commodity that doesn't bring in $1,200 for a calf, right? So I think there are vets out there that are willing to work. We just got to find them and train them. That's my passion project, at least.
We'll jump back to the questions online. Next question is, do you recommend similar testing protocols for CAE in goats?
Yep, almost the same thing. Goats are a little bit different on their, I don't test anybody again under 6 months for CAE. But I believe they're also positive for life, but they won't always develop arthritis if they're positive or encephalitis. The most common ones we see in goats are going to be the arthritis in the older ears. I rarely see the encephalitis version of that virus. Because usually if I have a neurologic goat kid, it's polio or an amprolium toxicity. So I try to not, tunnel vision myself like, oh, it's not CAE, because I've had a couple of them. But most commonly, you're not going to see these viruses and the effects of those viruses in our goats until they're about 5 or 6 years old. But if you're trying to be very aggressive, that virus is very similar. So the testing procedures are generally the same. And I think Rollins also has a CAE test that's pretty cheap too. So.
Okay, this next question is, they're about if they have OPP in the herd and they're trying to get rid of it. I guess they're asking, does it stick around? Does it live on surfaces? Can it survive in the environment?
Yep, generally no. It's usually through colostrum or milk. Oh, sorry, you guys heard the question. But it's generally only through milk, colostrum, and inhalation. It's kind of once it gets on a surface, it doesn't like CL kind of lives there forever. This particular virus is not very hardy, so once it's outside of the host, it doesn't last for. I couldn't give you an exact number, but it'll be usually killed by the heat or temperature fluctuations relatively quickly. So that's why I try to focus on where are the pinch points, which ends up being the colostrum and the birth. And then stocking density as well. Great question.
Next question is, how often do you test the new adults for OPP?
If I'm in an aggressive herd, new adults I test once they enter quarantine, and then I'll usually do it every 2 to 3 months. I do probably usually I think the when they get in there at day 1, and I usually quarantine them if I'm worried about it, day 60. And then I'll test them again every 2 months and then annually after that. Because if they're not shedding, if they're older, they're usually shedding it by 2 to 4 years. But most of the time you're getting a replacement, let's say at 2 years. It depends on how aggressive you want to be, but I'm generally screening once at quarantine, once they leave quarantine, and then two more times before the 1 year, and then doing that every year with the herd.
Next question is, how do you test for OPP? I'm guessing maybe like what type of tube, those types of things for testing.
I think it's serum. If I remember, it's an ELISA-based assay. Rollins, I think, says it's serum. I'd have to check for you.
But I guess they submit in a red top tube.
I think so. Yeah, if it's serum, it's a red top tube. Usually they don't do plasma, because plasma would be the green top tube. But I'm almost certain it's the red top tube that you spin down and separate off the blood clot. Yep, or let it sit. It will separate eventually if you don't have a centrifuge. I've learned that the hard way. You can't just spin it in a circle. It doesn't work. Also tried that. My poor vet student was embarrassed for about 10 minutes.
For last question we have so far in the chat, for commercial flocks, at what point does it make economic sense to start testing, or I guess battle OPP from a commercial standpoint?
I think it really comes down to the economics of how you're making your money, right? If you're lamb crop, if you're noticing that over the next couple of years, that you get your average daily gain, and your weaned lamb weights when they wean and you go to market, if you're noticing those obviously starting to drop, we need to investigate, is it nutrition? Is it minerals? Is it our infectious disease? Is something else going on? The hard part is those are hard to catch unless you get a hard bag right in front of you, right? For me, an easy, I can't really argue with the $1.70 test once a year for a flock, depending on how many you have. But even if you have, let's say 200 sheep, that's still only $400 to get the whole flock screened, plus a $2 session fee. $2 session fee. I can't keep forgetting that one. Again, you have to get the blood tubes, you have to draw the blood, you have to take the time to do all of that. But I think compared to unlike mastitis, OPP is a progressive one. So you're not going to get a sudden die off of all your flock or all your lamb crop, right? This is going to be a slow progression for, let's say this year we're here, and then 2 or 3 years down the road, we're less than where we were, 10 or 20%. That's going to be pretty significant from a lamb number is what you're aiming for. So it's hard to say economic wise. It really depends on the market, when you're selling your lambs, how many lambs you're selling. Because if I have 4 ewes, that's going to be a huge hit if you lose one to OPP versus a larger operation. You might have a little bit more wiggle room on that. But for me, if you have a diagnosis of OPP in the herd, like a confirmed one, I would very highly recommend being aggressive right off the bat because you don't want that to progressively get lower and lower until now all of your herd has OPP. Or bringing in new ones that then get infected. So you just spend a bunch of money on a new genetics or new animals and now they get infected with it and you just kind of shot yourself in the foot there.
Any other questions from the room or online, either one? No more last minute burning questions. We had someone ask about what's the Rollins webpage. We'll put that in the chat, but you can just Google Rollins Diagnostic Lab. And they have other labs across the state too, if you're located in North Carolina. And you can Google testing schedule and it'll show you what those costs were for some of those different tests.
I will say when you click on them, it'll say like roll or like if you click on that, like let's say you search for the test, let's say OPP, it'll bring you to the next page on that little, it'll basically be a column that says ROLL. That is just the site, the lab that you send it to because there's different state labs around the state. And so most of the testing, I will say for like serum or ELISAs or anything that we're talking about today, mastitis, that's done at the Rollins lab in Raleigh. But if you see a little, like sometimes the necropsies can be done at other ones, you'll see that on the list of where to send those samples and they give you the address and stuff like that too.
Yep, and I know if you Google fee schedule NCDA Rollins, it'll actually bring you a PDF that's a little bit easier to navigate than trying to search the website.
Yes, for sure.
Can be challenging.
It's gotten better. If Rollins is listening in, it has gotten better.
All right, so I guess we'll go ahead and wrap things up if we don't have any other questions. But we appreciate you guys joining online and those in person. Let's give Dr. Mzyk a hand of applause for coming out tonight. And so I will go ahead and put in a plug for the rest of the series of the North Carolina Small Ruminant Educational Series. And again, we are doing these last two workshops hybrid. And so the next one will be on March 3rd in Johnson County. So that's going to be Smithfield, North Carolina. And the topic is going to be stones and scours. Yes. So come on out to that one. Again, you can join online for Zoom for no cost, or you can come and join us in person. And the cost is $15. And that just covers your meal cost. So we encourage you to come out and join in person and network with other fellow producers. And then the last one is on April 30th, and that's in Iredell County. So that's going to be in Statesville, North Carolina. And that one is guarding the gate, keeping chronic diseases off your farm with biosecurity. So we encourage you to sign up for those. They are individual signups, but just go ahead and sign up for those now. We could probably throw a link in the chat now for those of you online that would like to go ahead and get signed up for those.
I did that.
We will share the recording once it's been processed out and hopefully maybe Dr. Mzyk's presentation if she's okay with that. So we'll get all that out shared with you. And if you guys have any other questions, just feel free to reach out. But again, we appreciate you all joining us and thank you. Have a good night.